Hello, everyone. I'm Vanessa Grossel, Policy Analyst at the Council of State Governments. I serve as Staff Liaison to CSG's Healthy States National Task Force, which is composed of 4 subcommittees. The task force is examining such topics as capacity preparedness and resiliency, leveraging innovation, state health systems, return on investment, and interventions to save lives. I'm joined today by Dr. Jane Engelbright, Senior Vice President and Chief Nurse Executive at HCA Healthcare, one of the nation's leading providers of healthcare services, for a series on Voices from the Front Lines. Dr. Engelbright, a nationally recognized nursing leader, co-leads HCA Healthcare's Clinical Operations Group and provides professional leadership for facility chief nursing officers across HCA Healthcare, and approximately 98,000 registered nurses working in HCA Healthcare hospitals, ambulatory surgery centers, and other sites of care. She also leads HCA Healthcare's councils in advancing a clinical agenda for leadership, operations, and outcomes, as well as professional practice. Dr. Engelbright joined HCA Healthcare in 1992, founded the Patient Safety Program, and has led teams working to accelerate and advance patient safety. She serves on the Joint Commission's Board of Commissioners and is a fellow of the American Academy of Nursing. Dr. Engelbright is also an adjunct faculty member at the Vanderbilt University School of Nursing, is broadly published, and was recognized in the Women of Influence program of the Nashville Business Journal. Welcome, Jane.
Thank you. It's great to be with you.
Let's dive right in. As an organization, how do you train and prepare for a pandemic of this scale?
Well, I don't know that we trained for this scale, but we do train, and we train every year as part of our emergency preparedness program. We have a drill every year on infectious diseases, and we last did that, thankfully, in fourth quarter of 2019. And so it was a great opportunity for us to kind of hone in on our basic practices of infection prevention, on handling surge capacity, on setting up alternative isolation facilities and stuff in each one of our hospitals. So that really stood us in good stead. We decided to do it at that time because we saw what was happening in China, and we knew there was a potential that could come to our shores as well. But certainly when it did come, we were surprised at how quickly and how rapidly it spread, just like I think most of the rest of the nation was.
What processes and procedures has HCA enacted to protect frontline workers during the COVID-19 pandemic? And do you see these processes becoming a universal standard going forward?
Yeah, I think there's a lot of things that we've learned and that we're doing better now that we are several months into this. And I think you're right. Some of these will stay with us for the long haul. You know, the number one concern that I think all of us have had is making sure we have adequate personal protective equipment for all of our caregivers so that they have the confidence they need to take great care of patients. So we began pretty early on with when we realized how interrupted the supply chain was going to be for a long time and how the demand for PPE supplies was going to increase, we began working on conservation and putting some pretty strict control systems in place. We created a PPE coordinator within every hospital and a sign-out process for each patient care area every shift to come down based on the number of patients they had, the type of isolation they had, the type of procedures that were being done that day, to actually sign out key aspects of PPE. Part of that was control, and also a big part of that was education. I think as we got into this, we had a fair amount of panic, and I want to wear the maximum protection for absolutely everything. And that conservation mode was saying, when do you need it? And we have coined a phrase, the right mask for the task, because different types of interactions with patients carry different risk and need different levels of protection. And so that process, I think, will continue for a while in terms of making sure we're picking. Instead of having, I think prior to this, we would only have 2, maybe 3 different types of mask. Now we have a lot of different types as we've reached out to other industries to get masks that typically had not been used in healthcare and bring them in, and we want to do that safely. So that's been a big part of it, is that PPE coordinator role, learning to use lots of different types and layers of PPE and put things together in combinations to make sure everyone is safe for whatever task they're doing. I think the second thing that's changed that I hope is a long-standing change is our approach to employee health. When we do have employees who have symptoms, who have a positive test, or who have an exposure and they're worried, we now have a way of keeping in contact with them through an app where we can daily check in with them, see how they're doing, answer questions, identify who needs follow-up, who needs a phone call, who needs someone to talk to. And so that ability to know how our employees are doing when they're sick, I think has been really very helpful to understanding how the disease is progressing and also identifying staff who need some extra help.
All right. Can you talk a little bit about how care has shifted to better protect patients?
Yeah. It's important to remember that not only are we caring for patients with COVID, but we're still caring for patients who have had heart attacks and strokes and babies and all the other reasons people come to the hospital. And so we have a strong commitment to keeping all of those patients safe. And we've created a framework that we call universal protection. And it has 4 really important pillars to it. The first is infection prevention, the kinds of things that hospitals are well known for in terms of keeping things clean and sanitized. But we've added a couple of extra areas of focus in that our facilities now, we have a universal masking, not only for our staff, but for any visitors, for patients when they're outside of their own personal room, and anybody who might be entering the hospital is asked to wear a mask. We also don't allow people to enter the hospital, other than patients who are sick or who are showing symptoms. We ask our staff not to come in. We ask visitors not to come in if they're having any type of symptoms. In order to kind of enforce those things, we've got the second pillar, which is access control. We've limited the number of entrances in and out of our hospitals, and we are channeling patients through a couple of doors, employees through a separate door, physicians through a door, and at each one of those entrances we have a screening process. That's where you're asked questions about, do you have any symptoms? Sometimes we're checking temperatures in high transmitting markets, and that's where we give you a mask if you don't have one before you enter. We've really scaled back the number of visitors we allow per patient at this time. It's just not good for the patients, and it's not good for their visitors either. And we've really looked at alternative ways that patients and families can stay in contact and get that very important emotional support that patients need when they're in the hospital through FaceTime and other types of virtual visitation. The third pillar we have is distancing. We really are trying to maintain social distancing inside our hospitals with distances of at least 6 feet. We have taken chairs out of our waiting rooms. We are asking people to wait in their car until it's time for their appointment, and we will text them and let them come in. We're trying to put all of our patients who have infectious diseases in a separate area of the hospital and try to keep some areas of the hospital without any infectious diseases on it. Our cafeterias, we've taken out a lot of chairs. In our staff break rooms, we've taken out chairs, trying to get people to distance themselves, particularly during times like eating when we have to take our mask off. And then finally, the fourth pillar is patient flow. So really trying to be sure that as we've limited entrances, patients often have farther to walk to get to where they need to go. So we're trying to escort as much as possible or have a very clear pathway so that people aren't wandering through the hospital trying to find things or just going to visit other people. That we really want to keep the traffic down and help people get where they need to get most efficiently. So with those four things, infection prevention, access control, distancing, and then monitoring the flow of patients through the hospital, we believe we've created this universal protection framework that will prevent the spread of infectious diseases inside the hospital environment.
How do you see care shifting to become more accessible, and what is the role of telehealth going to look like in the future?
I think that is, there's really two answers to that. First of all, from a provider and from a patient point of view, we saw really rapid adoption of telehealth technologies, especially on the outpatient area. I know I visited one of my physicians via telehealth visit while this was all going on and found it a great experience, as did he. We also found ways to use telehealth inside the hospital, whether it was specialist visits to COVID patients that could many times be done with telehealth technologies, or whether it was, as I mentioned, visitation back and forth between family members. We found that we could do a lot of our case management and other types of patient interactions virtually instead of everyone having to go in and out of the room. On the other hand, one of the things that really made it possible to see this rapid uptick in telehealth was the fact that we had good reimbursement for it. Some of that reimbursement is temporary, and if that goes away, we may see the adoption of telehealth services go down again. But I think it's got a huge amount of upside and can be a very effective way to deliver a lot of care if we can get our reimbursement lined up with the technology itself.
And what are some of the innovations you've seen as a result of the pandemic?
I'm always so impressed with how creative caregivers are. They are just natural problem solvers, and this challenge has been no exception. There have just been some great technologies and process innovations that have come forward. I've already mentioned a couple of them, an app to monitor employees while they're out sick, a lot of use of remote or virtual communication for patients, families, and members of the care team to limit exposure, limit the use of PPE that has to be consumed with a face-to-face interaction, and actually improve, in many cases, our efficiency or how many patients we can see in a given day. I think some of the other things that are more on the process side that our teams have come up with are things such as our terrific our terrific operating room nurses came up with an idea of helping in the ICU by forming proning teams. Surgical nurses are expert at patient positioning, and so many of them came forward and helped with the proning of patients in the ICU, which is one of the things we do with COVID patients when they're beginning to get respiratory problems, is turn them on their stomach so that the backside of their lungs can oxygenate better. Another one was they developed intubation kits. Again, when you go to intubate or put a breathing tube in a COVID patient, that's a very high-risk procedure for the teams that are doing that. And so they found ways to consolidate and make mobile for the intubation team all of the supplies they need so that they can be maximally effective and efficient in doing this and limit the amount of exposure to the team and to the amount of exposure to team members. So that's just a couple of ideas. I could probably go on for a long time about some of the things. I think we'll be collecting stories for a while.
Well, thank you so much for joining us today, Jane, and for sharing your insight with us. We appreciate you for making time during this crisis to share your expertise, which will help to greatly inform the work of our task force. I'm Vanessa Grossel at CSG headquarters in Lexington, Kentucky, and I've been speaking with Dr. Jane Engelbright, Senior Vice President and Chief Nurse Executive at HCA Healthcare in Nashville.